Welcome to the Protecting Your Nest podcast. Achieving metabolic health is the key to preventing most chronic diseases. That's why I'm on a mission to create awareness that by simply understanding metabolic dysfunction and preventing it, you are well on your way to living a life without chronic disease. The N in the nest is about what you eat and the what you eat and when you eat. Today we will have a conversation about the when. Today we will talk about intermittent fasting, which may be the fastest way to heal from metabolic disease of all the components of the NEST and ROPE acronym. Who better to discuss this topic than my friend Dr. Jason Fung, who for many of us has shed a much needed light on the benefits of intermittent fasting like no other. Dr. Jason Fung is a Canadian nephrologist and a world leading expert on intermittent fasting, low carb, and of course, the treatment of metabolic disease. He has written multiple best selling health books, including his most recent project, The Cancer Code. He has also co founded the Intensive Dietary Management Program and is a graduate of the University of Toronto and completed his residency at the University of California in Los Angeles. Dr. Jason Fung, it is my pleasure to welcome you to Protecting Your Nest.
Hey, Tony, great to be here. Thanks for having me.
Yeah, it's a very, very good day for me to have you on. I've been wanting to do this for some time. And, as you know, we're busy. We're actually recording this during our lunch break. And I wanted to, thank you for your sacrifice of your time today. But more importantly, the work that you've done to help guide us and help us think outside the box. So I do want to mention to those who are watching this or listening to this that we did record two short videos, one about, the fastest way to reverse type 2 diabetes and the other about how the brain survives when we're fasting. So make sure to check out my YouTube channel to get those videos in front of you. So let's get started just by, thinking about your journey. And I'm curious, if you think about it, you're doing a podcast with me. You write books. You lecture. So I'm just trying to understand what's driving you to do all this great work that's making an impact. What's your driving force?
Well, I think it's much the same as probably you and a lot of the doctors in the low carb space. Um, One of the things is that, I deal with kidneys. I'm a kidney specialist. And over the years, it's been sort of taken over by diabetes. So we know that there's been a big epidemic in obesity starting in the 70s. And then in the late 80s, 90s, there's this big epidemic of type 2 diabetes, which followed, very closely the obesity epidemic. And of course, diabetic nephropathy, which is kidney disease that develops from type 2 diabetes, develops around 15 years after the onset of type 2 diabetes. So it's for any diabetes, but I'm speaking mostly of type 2. The thing about it is that, so that would put me in the time when I'm starting my practice, and I'm just seeing more and more diabetic nephropathy all over the place. And it's a terrible disease. So, you treat patients, you get to know them over a number of years, and you hate to see things happen to them. But I was seeing it all the time. So not just the kidney disease, but the people who develop diabetic kidney disease also get a whole lot of other problems. They get heart attacks, they get strokes, they get cancer, they get peripheral vascular disease, they get amputations, they go blind. There's a lot of problems. And I'm sort of watching this unfold in front of me.
Right.
And so, I had been trained to sort of in the 90s when the mainstay of treatment was a low fat diet. And also, the treatment of type 2 diabetes is essentially to give as much insulin as you need to get those sugars normal. And it didn't really work. So in 2008, 2009, there was a couple of very important studies that came out, the Accord, the Advance, the VADT, that showed that lowering blood glucose by giving lots of medication did not improve any of those important outcomes like heart attacks, strokes, death. And so I really started to think about this problem. So this, health issue, which had become more and more a bigger part, and really sort of breaking my heart, sort of because you see all these bad things happen to people you treat and you care about. I really got interested in the question of weight loss because it became obvious to me that we were, with those studies, we were really barking up the wrong tree,
Mhm.
because type 2 diabetes is caused, in large part by weight gain. And here we were giving insulin, which is a medication that causes weight gain. And at the same time, uh, we thought we were doing good. And it's like, but wait, if they're gaining weight with the medication that I prescribed them, then what's happening is that their blood sugars are getting better, but they're gaining weight, so their diabetes is actually going to be getting worse. So
Right.
what we're doing is basically symptomatic treatment. That is, the cause of the high blood sugars is the diabetes, and we weren't doing anything about that. Yet we were trying to get the symptoms better. So it was no different than if you give Tylenol for a really bad abscess, for example, and
Mhm.
not giving antibiotics. So you're treating it. So you're basically treating yourself. Doctors, we were just treating ourselves because we were making ourselves feel better, because we could no longer see those high blood sugars. At the same time, things were getting worse. So I really thought about this, and understood that this is the wrong thing. We're doing the wrong thing, and we're treating it. Every doctor was doing the wrong thing. It wasn't just me, but it's the way we're being trained. It was the wrong thing, because we are taking this dietary disease and we are treating it with a lot of drugs, and it wasn't working. So that's when I realized that, hey, if you even look at the question of diabetic nephropathy, the solution is right there. If you don't have diabetes, you don't get the nephropathy. It's the same with diabetic retinopathy and diabetic neuropathy and all those. So the question is not, what drugs should I give? Should I put them on dialysis? Which are still important questions. But how do I get these people to reverse their type 2 diabetes? Because that was the one big lie that we had told ourselves. And in fact, if you go today to the website for Diabetes Canada, it says type 2 diabetes is a progressive disease. I'm like, and it used to say this in the American Diabetes Association too, and the Australian Diabetes Association. The Americans in Australia have since pulled that back, but Diabetes Canada still says it's progressive. And it's a complete lie, because everybody knows, I know, and every patient practically knows that if you lose weight, then that type 2 diabetes almost always gets better, if not
Mhm.
completely reverses. So it wasn't irreversible, it wasn't progressive. Is that we are treating the wrong thing. We're trying to give drugs for a dietary disease. So that's when I started to rethink about um, what is it that we're trying to do here, and so on. And I realized that really the question is how to lose weight. Then I really thought about how to lose weight. And again, I was taught, as I imagine you were, Tony, is all about calories. As I
Right.
started to think about that, it was all complete garbage as well. So again, we had lied to ourselves because we wanted to be simplistic, and people were saying things like, "Oh, it's calories in, calories out. It's all about calories. It's thermodynamics." That's all pure crap.
Right.
Nobody's trying to repeal the laws of thermodynamics, but the point is that when you eat a food that has calories, it's just a unit of energy.
Mhm.
When you eat those calories, so you say you take two foods, you take an egg and you take a cookie, and you have the same number of calories. So, and you can take a block of wood, which has the same number of calories, because when you burn it, it has a certain amount of energy. When you eat wood, it doesn't get absorbed, so there's no actual fattening effect of it. So it's not the calories, it's actually what your body does with those calories. So if you eat an egg, certain things happen. And if you eat cookies, certain things happen. That is, your hormone levels change entirely. So you eat a cookie, your insulin spikes way up. You eat an egg, it doesn't do anything. Okay, your blood glucose spikes way up. You eat a cookie with an egg, it doesn't do anything. And yet we were supposed to pretend that these hormonal changes, which are induced by different types of food, were completely irrelevant, right? It's like our whole body runs on hormones. Hormones are the messengers that tell our body what to do. Okay. So if you eat lots of cookies, for example, and same number of calories versus lots of eggs, you get lots of insulin with the cookies and not very much insulin with the egg, for example. And we know that insulin does certain things. Insulin tells your body to store fat. That's just what it does. That's its normal job. So it blocks you from burning fat. So insulin inhibits lipolysis, which is a known fact.
That's right.
It inhibits the breakdown of glycogen. It enhances glycogen synthesis. Like,
Hmm.
these are all known facts.
That's
And
right.
yet we're supposed to ignore that completely. This huge difference. So insulin way up with cookies, insulin way down with eggs, same number of calories, totally different hormonal profile. That's supposed to be completely irrelevant to the body. It's like nobody's repealing thermodynamics. But if you're storing all that food energy because insulin's telling your body to store it all as fat, well, what's going to happen? Well, you're not going to have energy for the rest of your body. So you're either going to have to reduce your energy expenditure or you're going to have to eat more so that you do have energy. Okay? And that doesn't break any laws of thermodynamics. But what we're trying to do is sort of go one step beyond calories, which is a really stupid sort of very basic first order thinking. Like, it's anybody who talks about calories, like, they haven't thought very hard about the entire physiology, because it's all about physics, that is thermodynamics, and it's not about physiology, which is what happens in the human body. Because what happens in the human body is about hormones. That is, when you take those calories, your body can either store it or it can burn it. And which one it does depends on the hormones in our body at the time that you take it. So that's not breaking the laws of thermodynamics here. If your body burns it, great. If it stores it, you get fat.
That's right.
But it's the same number of calories, right? You're not breaking any laws here, and that's the point. The people who were saying that you could eat cookies for dinner, like, clearly didn't understand that there's a huge hormonal component
Hmm.
to this. And it's just like when you give people insulin. It's like, well, you're not giving them calories when you prescribe insulin, but
That's right.
everybody gets fat. It's a known side effect. Every doctor knows it, every nurse knows it, every patient knows that when you give somebody exogenous insulin, they get fat, like, they gain weight. That's just what happens. So when you think about it, it's clear that what's more important than the calories, because it's not that calories don't matter. It's that it's not the calories. It's sort of what's driving those calories. It's the second order thinking, that is, we're trying to understand that to a higher degree. And this is where it's you have to understand about hormones. It's much more like people love to be simplistic and say it's just calories in, calories out, but you don't get anywhere. Like, if that calories in, calories out thing worked, I wouldn't bother doing
Oh
anything
yeah.
else.
You're right.
Like,
Yeah.
I've been trained on it. I've been using it for 10 years. I'll tell you, and every doctor knows this, and that's the reason doctors don't give weight loss advice, is because what we were taught, that is calories, 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 didn't work at all. Like, had about a 0% success rate. That's why doctors stopped giving that advice. They said, well, it's not,
Yeah.
what I do. But it is what we do. And this is so important. It affects everything that we do. It affects COVID risk, right? It
That's
affects
right.
heart attack risk. It affects stroke risk. It affects cancer risk. It affects, blindness, amputation, kidney failure, nerve damage, everything, atrial fibrillation, everything that we do is affected by obesity. So we had given up this entire field because we didn't want to think about it. And what we were taught had such an abysmal failure rate that we gave it up. But that's the wrong thing to do. We need to understand it so that we can give the proper advice, so that we're not mechanics here. We're not just putting in like pacemakers and dialysis machines. Like, we're here to help people. And this is the way that we have to help people, is getting to the root of the problem, which is what you eat. That is, hey, don't eat so many cookies. Why don't you eat some eggs and broccoli instead? And when you eat, that is, don't eat all the time, because this was another hugely stupid
Oh yeah.
advice, was to eat 6 times a day. Like,
Yeah. To
Why?
increase
Why
your
would you want to
metabolism,
do
they would
that?
say, right? Increase your metabolism.
Yeah, and there was never any actual evidence that it worked.
Right.
It was just made up and then repeated often enough that people thought it was true. But and this is why fasting got such a bad rap for so many years. And then that's when I started to think about fasting. I said, well, why can't you just have people not
Mm,
eat? Like, what's going to happen? And when you look back into the physiology of what actually happens, it's very important now more than ever because we have the obesity epidemic now and not 50 years ago. It wasn't that important 50 years ago
that's right.
because we didn't have as much obesity, we didn't have as much type 2 diabetes. Smoking was a big problem, other things were a big problem. But obesity now is sort of the overwhelming factor here, even for something like COVID. I mean, it's clear that obesity plays a risk factor, so we need to lose weight if we're going to lower our risk against this virus if we are to get it.
It's weird because, you try to break things down in very simplistic terms so that the average person understands, and obviously our clinical colleagues. But, and we've seen studies that clearly show that, intermittent fasting, low carb, things like that reverse metabolic disease. But why do you think our colleagues haven't gotten the memo?
I think it's because they've sort of spent so long in this sort of teaching that it's all about calories. Like if you look at the academic centers, virtually everybody believes it's all about calories,
Hmm.
right? And it's hard to get in there because people wind up think it's such a core belief because you go to the universities and everybody there says it's calories, calories, calories. That's all it is.
Hmm.
Caloric deficit. That's all you need to do. That's all you need to know. And they ignore the fact that they've been incredibly unsuccessful at making a difference in people's lives. But at the same time, because they're in this ivory tower where they're more about writing papers than seeing patients, they don't see how much damage they do with their horrible, horrible advice. I see it because I see people getting their feet chopped off.
Right,
You
right.
see it, and Brian sees it, and Tro sees it, and everybody else sees this, but they're busy writing papers. And if you write papers talking about how it's all about calories, you get promotions and people say how smart you are to focus on calories and stuff, right? And there's all these people, there's all these drug companies which are
Hmm.
perfectly happy to support this whole calories thing. We know, of course, that Coca-Cola, for example, spent millions of dollars promoting this idea that it's all about calories. Why? Because then a calorie of Coke is no different than a calorie of
Right.
broccoli. And the point is that if you were to ask your grandmother that, about calories, she'd say, well, that's really stupid, right? There's foods that are fattening, like cookies, and there's foods that are not fattening, like broccoli. Nobody gets fat eating broccoli. It just doesn't ever happen. Whereas the ivory tower academics say, yes, you can get fat eating broccoli. It's like, no, you cannot. Like, get your head out of your ass because it doesn't happen. It's like crazy. But you know what? They're in the university. They don't see the consequences of their bad advice. They see that when they write papers about calories, that they get lots of accolades. When they start to say, "Oh, look at these stupid diet people who are, down in the trenches. They don't know what they're doing. I'm writing research papers and therefore I'm right. You're getting money from the drug company. You're not seeing the bad effects." Well, of course, what's going to happen? And then all your colleagues are saying how smart you are because you're writing about calories. You're busy denigrating, all these quacks out there who are saying calories are not the main issue. So you see how that perpetuates itself. Unfortunately, you really got to look at the track record. Like, have they been successful? All these academic nutritionists and stuff who told us, for example, that eating fat was really bad for us. Like, you can go back. Their track record is absolutely abysmal.
Hmm.
In the 80s, when we're in this is around the time that I'm learning all about this. They're all about low fat, low fat. Don't eat butter, right? Saturated fat. Don't eat butter and eat margarine. Margarine turned out to be full of trans fats. So we were eating butter, which we know now doesn't really affect your risk of heart disease. And this was in the Journal of the American College of Cardiology, JACC, put out a paper, a review paper on saturated fats. And they said meat, saturated fat in meat doesn't really cause heart disease. Saturated fat and dairy, whole fat dairy, it doesn't cause heart disease. So we know now that butter, for example, and animal fats, they don't cause heart disease. So instead of eating lard and butter, we ate margarine, which was turned out to be full of trans fats, which actually did cause heart disease.
Right.
It's estimated. So they estimate that you know caused about 100 to 200,000 heart attacks per year. So, in our sort of haste to get people away from fat, we were actually causing heart disease. So, we were doing the opposite of what we should have been doing, which is protecting people. We were causing them to have heart disease. And it took 30 years. You know this because all through the 80s, 90s, 2000s, all this stuff about low fat, low fat, low fat. Remember, I don't know if you remember, but there's the step 1 and step 2 diets for heart disease patients. They don't have that anymore. But step 1, if you had a heart disease, you ate a low fat diet. Step 2, if you had another heart attack, which was likely because you're eating all this margarine, then you ate an ultra low
Yeah,
fat
just like,
heart
yeah.
diet. It was awful.
Yeah, it was
So
hard.
this is their track record. They weren't making people healthier. These academic nutritionists were making people less healthy. So they told people not to eat butter, which was and eat margarine. They told people not to eat nuts, which are high in fat. They told people not to eat things like avocados and olive oil. Then by the 2000s, everybody's doing these studies, and they're like, "Whoa, these are hugely protective." The Leon Diet Heart Study, and all these Predimed and all these other studies. You can argue about it, but the Pure study, again, showing that's epidemiologic data, but again, showing that, hey, this wasn't bad advice. So I think it takes a long time for them because they don't see the consequences of what they're doing.
Yeah.
And but we see their track record, and it's been really, really bad. Like, they haven't been a net positive
No, no,
on patient health. It's been actually quite negative. And Zoe Hartcomb wrote years ago that when you look back at the evidence in 1977 suggesting a low fat diet, it's zero.
it's just not
It's
there.
nothing. There's nothing there, and it took us 40 years to get back to that point,
Yeah.
while untold damage has been done. Same thing with all this calorie stuff and not fasting and all this stuff. Fasting got a bad rap for a while, and it's like, why? It's been used for thousands of years.
Yeah.
At least 2021 years, for example, because we find it in all the major religions. It's like, if there's something wrong with fasting, don't you think we'd have found out 2,000
Yeah,
years ago?
we would have learned.
Not like fasting is okay for 2,000 years, but hey, all of a sudden in 2021, it's bad for you. What?
You just have to do it safely, and it actually is something that may have made people not do it because they didn't understand how to do it. But I actually am curious for you because you have a great team that's doing a great job reversing diabetes fairly quickly with intermittent fasting and other types of fasting. So I'm curious, if I was a patient who met you and I wanted to take this approach, what's the process for you to treat your patients? What do you surround them with so that they can be successful taking on this intermittent fasting approach?
I think the most important thing, there's several. One is education. So getting the right information. So podcasts like this are a great way to get exposed to the ideas. I've produced a lot of YouTube videos talking about fasting, so short, sort of 10-minute videos on all different aspects of fasting, benefits, how to do it, different types of fasting, what problems can crop up. So that's one thing, is getting the right information. Second is making sure that your sort of team is on board, that is your physician and so on. And that's a lot easier to do now than it was sort of when I started in 7-8 years ago, when everybody thought I was complete
Yeah,
nuts,
like,
right?
yeah,
Remember this 2013, 2014, right? Everybody thought fasting was just the worst thing you could
Right.
possibly do to your body. So getting the right physician, because again, it is important. And our number one rule is always be safe. So make sure that there is somebody monitoring you, somebody you can talk to that you can trust, who knows about fasting, but also can adjust your medications if you are on medications. The third is to make sure that you have sort of support, like community that is supportive. There's nothing harder to do than doing it on your own. And that's true for anything, actually. So making sure that you get the right support. And those are the main sort of pillars. So the information you can get, there's books, there's podcasts, there's YouTube videos, there's all kinds of information that you can get. Professional help, like so at the fasting method, there are coaches that you can get, there's physicians that can help you. And then the right community, which is you can find on, say, so we have an online community at the fastingmethod.com, but there's
Yeah.
also the free Facebook groups, and there's all these groups that talk about fasting online. So there's lots out there for support right now. And just remember that fasting is really any period of time that you're not eating. So we're not talking about jumping from sort of 6 meals a day to not eating for 40 days and 40 nights. Like you can just take it slowly. Like instead of 6 meals, cut it down to 3 meals a day. Now, this is how we ate in the 70s: breakfast, lunch, dinner, no snacks. Then, when you're comfortable with that, you can slowly cut down your eating window until you get something that's starting to make a difference. And you can measure it with your blood sugars, for example. You can get a continuous blood glucose monitor. You can check your blood sugars, or if it's your weight, you can measure your weight or your waist size. And then you can slowly, gradually build up to the point that you're comfortable.
Cool. Let's look at a couple of myths that people have about intermittent fasting, because as you said, the information is really critical. And I'm so happy that your team has created a lot of resources to help people, because I found that coaching is so important, and then the patients end up coaching each other, when they have a group to do it with. So I really appreciate that. So let's knock out a couple of those. So the first is that intermittent fasting leads to muscle loss. What would you say about that?
That's one of these persistent myths. And one of the things you have to understand is that it's not really, that's not really what happens to muscle. So we know how muscle develops and how it shrinks. You grow muscle when you exercise it. And when you don't exercise it, like when you go to complete bed rest, for example, which happens, within the hospital and so on, you lose muscle extremely quickly. So it has very little to do with what you eat and what you don't eat. Muscle grows when you put stress on it, and muscle shrinks when you take the stress off of it. That's why you send an astronaut in peak physical condition into space, no gravity,
Right.
muscle starts going downhill immediately, right? Immediately. So within days of zero gravity, actually within, a day of zero gravity. So what do? Of course, they exercise, they put stress
Right.
on the muscles. So that's how you grow muscle, that's how you shrink muscle. Very little to do with what you eat. If you could simply grow muscle by eating protein,
Mm-hmm.
hey, we'd have a lot of Arnold Schwarzeneggers in this country. We probably have like 50% of the population looking like that. It doesn't happen.
Yeah.
So you have to get it out of your head that what you eat affects muscle growth. It only does at the extremes. That is, if you are extremely protein deficient, then yes, you are not going to grow your muscle. Yes, you do need protein. So the recommended daily amount of protein is zero point 0.8 grams per kilogram per day. Most people in North America are eating somewhere around 1.3, 1.2, so 50, 60% more protein daily than is actually necessary. And we've been doing that for, 40 or 50 years. So it's not like we're protein deficient in this country. So, a few days of not eating protein are unlikely to cause much muscle loss. A lot of these studies, and again, the other thing is that if you think about it, our body stores excess food energy in the form of sugar and in the form of body fat. If you are going to need it, then your body is going to take that energy from sugar and from body fat. Very little comes from protein. As in, if you have to believe that our body is so stupid that we store energy as fat, but the minute you need it, you start using muscle.
Right.
Like, why would your body do that? Right? It's like saving up firewood for the winter, and the minute it gets cold, you chop up your sofa and throw it
Right.
in the fire. Why would your body be so stupid? Like, do we believe that Mother Nature is so stupid? And we actually survived to become the dominant species of this planet by
That's right.
being so stupid? Like, do you really think that? And so the whole thing is dumb. If you look at people who are overweight, because of course that's the main reason people are fasting, it's estimated they have something like 40 to 50% more protein than a lean person. And that's not muscle necessarily. A lot of it is connective tissue, skin, connective tissue, blood vessels. That's all protein. That all needs to go.
Right.
And what's interesting, and we have no data on this, of course, just anecdotes, but we've treated a lot of people for weight loss. Some people have done extremely well. And we've never sent a single person for skin removal surgery. And we think the reason is because the body actually catabolizes some of that protein
Mm-hmm.
for energy. And that's not a
Mm.
bad thing, it's a good thing. And this is the whole idea of autophagy, is that it's a breakdown of these sort of molecules, subcellular structures, and it's not a bad thing, because the first step in rejuvenation is actually to get rid of this old stuff so
Right.
that you can replace it. The body does something very similar. If you have no protein, such as when you're fasting, your body does use protein, and it's going to take protein from everywhere.
Mm-hmm.
But then it's only going to regrow those protein where the stresses are. So if you
Mm.
are exercising, your body says, hey, I need those muscles. I'm going to rebuild those muscles. Same thing, you go in space, your body breaks down muscle, says, actually, I don't need it. Or the skin.
Mm.
There's a continuous, turning over of cells in our body. Skin cells is one of the most common. So when your body turns over those skin cells and it says, hey, I don't need those skin cells, it's going to burn it for energy. If you never fast, then why would your body burn anything for energy? It's is trying to store energy, not burn it. So we actually haven't had as many problems with excess skin in people with large weight loss compared to others. And that's just anecdotally. I can only tell you anecdotally.
Yeah, I've seen that as well. I've certainly seen people, have skin tags falling off and all kinds of cool stuff that we weren't really thinking about. And then all of a sudden, like, Doc, I've noticed this is happening. So it's kind of like the good side effect of this work. And I find that people do pretty well with fasting. And but they do have these other misconceptions. Doc, I'm always going to be hungry. Doc, is going to slow my metabolism. So what's your thoughts on those two concepts, hunger and metabolism?
Yeah, those are probably the two other main concerns. So one is hunger, and yes, you are going to get hungry during fasting. That's just natural. But on the flip side, you have to understand that the hunger does not continue to build, and this is what people are always worried about. That the hunger is just going to keep going, keep going, keep going until it's intolerable. That's not actually what happens when you look at studies of fasting. You see that hunger does build. So it tends to peak at three times: breakfast, lunch, and dinner time
Hmm.
in general. So there's a learned response to that. And when they study what happens to your hunger levels when you miss a meal, so say you skip lunch, like I'm skipping lunch today, what happens at 12 o'clock, 1 o'clock? You're hungry, then it crests, and then it falls. By 3 o'clock, 4 o'clock, your hunger level is actually no different than if you ate. And that's really interesting, because what your body has done, of course, is taken the calories that it needs. So instead of taking your lunch energy or calories, you take that calories out of your stores, which is glucose and body fat. So if you're diabetic, hey, great. You've taken those 400 or 500 calories from your blood glucose and used it up. Or you've taken 400 or 500 calories from your body fat and used it up.
Yeah.
That's great. If you're trying to reduce your blood sugars, if you're trying to lose weight, that's great. So the hunger is going to be, it's a real issue. So there's ways to deal with it. But you have to understand that if you ignore it, it will actually just go away.
Hmm.
The thing about the metabolic rate, again, complete fabrication from most people, because again, you have to understand a little bit of physiology of what happens during fasting. So we know, and we've known for 50 years, that when you don't eat, insulin falls and your counter-regulatory hormones go up. Counter-regulatory hormones, and this is basic sort of first year medical school stuff. Counter-regulatory hormones includes activation of the sympathetic nervous system, including things like noradrenaline. So essentially, your body is not shutting down at all. It's actually increasing things like growth hormone and noradrenaline and cortisol, and it's actually stimulating and activating your body. That's why you have more energy when you fast, because you're liberating the pathways to your body fat. You can't burn body fat when your insulin's high. When you're eating, you have no access to burn body fat. You've completely shut them off, right? Insulin inhibits lipolysis. You cannot burn body fat when your insulin levels are through the roof. When your insulin levels fall, that's when you can use those fat stores. And you're not going to feel tired because you're pumping up the sympathetic nervous system. That's a fight or flight response. So your metabolic rate doesn't fall. In fact, one study which looked at 4 days of fasting, so they measured VO2 and they measured energy expenditure, and they found that if you measure compared to day zero, 4 days of not eating, you're burning actually 10% more calories per day than when you were eating,
Mm,
and your VO2 went up 10%, which means that your body is metabolically
that's right.
more active.
That's
And it's because of these counter regulatory hormones. That's the entire idea. And it's a protective mechanism. If you think about it, if you're a caveman or cavewoman and there's no food, if your body starts to shut down, you're going to die because today you're not eating. So tomorrow you have no energy to go out and hunt or forage. And the next day is even worse, the next day even worse. You can see how that's a big downward spiral. And we would have all died
that's
in
right.
those
That's
caves.
right. That's right.
So our bodies are simply not that stupid. What we do is we don't turn down our body rate, we switch fuels to our stores. We switch to body fat. We say, okay, I'm going to open up the stores of body fat and I'm going to pump you full of energy so that you can go out and hunt and find some food. So it's a survival mechanism, right? And that's the whole point. In the modern world, of course, we're not facing that situation, but what you have to know is that, yes, the studies show that there's less problems with a decreased metabolic rate compared to chronic calorie restriction, for example.
Wow. I know we're going to be wrapping up shortly. So I just wanted to ask a question more about your health system. I know you have a different health system than in the United States, more universal. And I also know that you may still have some frustrations that you face as you try to teach this message of healing. So maybe bundle those answers together. How is it? Is it easier or more enjoyable to be in a health system that's more universal as you try to teach this message? And do you have any things that are still frustrating you about this care you're trying to deliver?
Yeah, I think now I've practiced in both Canada and the United States. So I have to say that physicians are trained very much the same. And I think it's about the same. It's not about reaching so much the physicians, just the physicians, but reaching sort of everybody. I think everybody, this is something that everybody needs to know
Yeah.
because it's a sort of universal tool for people to get themselves better,
Hmm.
right? This is a way for them to empower themselves so that it's not a matter of if you have weight to lose, if you have type 2 diabetes, you're not saying, oh, well, I'm just going to see my doctor and see what drug he's going to give me. No,
Hmm.
you can do something about it because
Yeah.
you have the knowledge to do it. And what's frustrating, I think, is that there's so, like, things take so long. Like, even look at the debate about saturated fat. I mean, it took 40 years of people dying and not eating fat for us to finally get to the point where we can say, there's still a lot of people who don't believe that, lots of people who demonize fat and so on. It took 40 years, but in 40 years, so many people are going to be harmed by this message that, hey, you can't do anything, you should just look at calories, never fast because it's really bad for you. It takes so long because and some people say it's because the people who built their careers on this
Mhm.
are still the ones in power, so science advances one funeral at a time. It's still true to some extent because you have this incredible inertia, like just no will to move from the people in the academic centers, because they're like, hey, why would they want to move? They're at the top. They don't want to move. They want to just keep saying what they're saying and
Mhm.
keep doing what they're doing. They're getting money from the university, they're getting money from the drug companies, they're getting money from the food companies, from Coca-Cola. They're making out like a bandit, and it's not their patients who are getting sick. Like, they don't see the problems that they're causing. So the frustration is sort of how long it takes. Like, why are we still teaching this message to medical students about type 2 diabetes? That it's chronic, it's progressive, and the key to treating type 2 diabetes is getting your sugars down and giving insulin to do it. Like, how is that even, like, in this day and age? Like, how do we even get, like, I think that's frustrating to me,
Mhm.
because every time I see a person who comes in with sort of diabetic kidney disease, I always think, you know what? If I could have talked to you like 7 or 8 or 9 years ago, because I didn't know this before then, and I'm sure their doctor doesn't know this now. If I could have got to you, and if people had been telling you the right message, I don't think you would be having this problem. And it's really hard to sit there and think day after day, boy, I have this nice person in front of me who's getting heart attacks, strokes, their feet are going to get chopped off, they're having gangrene, they're going
Mhm.
blind. And I'm sitting there thinking, I actually could have prevented this all. You could have actually prevented it all if you had the right information.
Right information.
And it's terrible, and that's so frustrating, because you know there's a lot of money in
Mhm.
there's a lot of money in insulin, for example, and drugs. And unfortunately, it's frustrating, because the people that they give a lot of money to are those university people
Mhm.
who have the ability to change this by teaching the medical students, by getting the message out there, but they have no incentive to change,
Mhm.
because the drug companies are just filling their pockets. And they don't see it that way. They see themselves as the good guy.
Mhm.
But to me, it's very frustrating, the whole conflicts of interest, financial conflicts of interest. Like, honestly, I think that all of those like, university, if you're, if I was making the rules, I'd say, if you're in the university, you are not allowed to take any money whatsoever from any drug company. And
Mhm.
people will say, well, where are you going to get the money from? It's like, you're supposing that bad research is better than no research.
Right.
I don't think that's
No.
true, because we know that if you fund a study, that's biased research. It's bad research. Anytime it's funded
Yeah,
by a drug
that's
company,
just by
the results are suspect.
yeah,
We know
publication
that for
bias is
sure.
the term they use. Yeah.
Yeah,
Just
because
yeah,
it's an unconscious bias, and people are not bad people.
right.
It's just the system is not correct. And this is frustrating, because people go and defend and say, we need the money for research. We need the money for research. It's like, no, bad research is worse than no research. Give
Right.
me no research rather than bad research, because at least I won't get the wrong answer.
Yeah.
And that part to me is always frustrating. I'm always feel like I'm sort of beating my head against the
Yeah.
wall on this, but
Well, I'm actually excited. I had Doug Reynolds on a previous episode. And so, as those who are listening may know, he helped to start Low Carb USA. But with the guidance of folk like Adele Height, Pam Devine, and even Dr. Eric Westman, they came up with the Society of Metabolic Health Practitioners. My hope is that as that grows, that there will be a landing place for clinicians like ourselves to gather, share, think through what the next step should be, and then have an influence on the ADA and the Heart Association, et cetera, and maybe even maybe we can teach these lectures within the schools. Maybe we can provide the handouts that they need to give to patients that speak to metabolic syndrome. And so that's kind of my hope. And so I'm optimistic that that'll happen, but I know it's going to be a lot of work and a lot of dedication. So, but I'm glad we have people like yourself, myself, that'll help lead that. And so, as we kind of wrap up, because we always want to make sure the people providing care are healthy, and that speaks to you and me. And I know we both have to go and see patients shortly. I want you to think about what your thoughts are for your you're coming up? What are you going to focus on? And my nest and rope acronym talk about, nutrition, exercise, less stress, more sleep, how we think, avoiding trauma. And then the rope in that acronym is relationships, avoiding organisms. I think we've done a good job because we've avoided COVID. Uh, Pollutants in the environment and in our food, and then of course protecting our emotions and our life experiences. So when you think about that acronym and what you're going to focus on for 2021, what would it be for you?
Um, yeah, I mean, I think that relationships is probably the thing that's really under attack at this point. I mean, they're all important, of course, but it's an unprecedented time where you're not allowed to go, like, to see family, to see friends, uh, and it's such a one, who wants to live like that, and two, I think it actually causes a huge amount of mental problems, which wind up turning into physical
Mm-hmm.
problems,
Mm-hmm.
by this sort of not seeing people, not touching people. I'm not sure I like it. I'm not sure which one is better or worse. And that's for debate. And I don't, it's obviously a hot topic for a lot of people. But relationships, at first everybody makes an effort to go on Zoom, but honestly, and we all know this, a year down is not the same thing. Zoom
Right.
meetings is not the same thing.
That's right.
It's just not, and it's a very important part. So we got to do what we can do to really preserve those relationships, because that has been really under attack from sort of COVID. It's been harder than ever to do. We used to have these meetings that we could go and talk to colleagues, and these dinners and stuff, and you'd get together with friends, and you'd have so you think back, we had Easter, didn't see anybody, Christmas, didn't see anybody, like, from my family. I mean, because nobody, we're under stay-at-home orders.
Yeah.
Thanksgiving, didn't see anybody. It's going on a long
Wow.
time. Last
Yeah.
Easter, didn't see anybody. Like, it's a long time, and this is something we have to. Like, I talk to them on the phone. Sorry, I
Mm-hmm.
talk to my mom on the phone and stuff, but it's not the same, and it's actually taken a huge toll on a lot of older people, and they're you can see they're just going downhill
Yeah, it's
very quickly.
not good for them. Yeah.
Yeah, and again, it's the people making decisions assume that locking people down is going to be better than not locking people down. Yeah, it's a debatable point. I don't know what the right answer is. I just know that this is actually, there's a lot of issues that are not being seen, that I hope we need to make sure that we bring them back when, vaccines are good and stuff. We need to make sure that we really work on those.
Yeah, I agree. And I know that I'm making efforts to do exactly that. Most of the people in my family, have been vaccinated, so that, the powers to be, are saying that we could do a little bit more getting together because of that. We're still being super safe, but totally on the same page with that. And I do think that relationships are foundational. I definitely plan to do the same thing with the relationship piece. So thank you for sharing that. And I guess as we wrap up, best way for people to find you. And I guess you should at least spend just a second just talking about that last book. Not much, just so people know what that cancer code's about.
Yeah, so if you want to follow me, I'm on Twitter at Dr. Jason Fung. That's Dr. Jason Fung. YouTube is just Jason Fung, but there's a lot of great videos there. Thefastingmethod.com is the program we have for helping people fast. And then just very quickly, the Cancer Code is the latest book. It's not so much just about sort of metabolic health in terms of what to do, but it's really an exploration of how we think about cancer as a disease, sort of the paradigms of how we look at cancer, what implications it has. Honestly, I actually think it's like the most interesting problem in medicine today, like the most interesting medical sort of mystery that there is. That is, we've made so much progress on so many of these other diseases, heart disease and all this other thing, but we've made comparatively almost no progress in cancer. And part of it, I think, is because we don't understand this disease. The disease is completely unique. It's a cell that comes from your own body and somehow turns into this thing that kills you. And it's like, why? Why does it do that? And this is a question that the book is trying to answer. And it's really just a sort of takes you through how we see it, how we currently see it, because there's been a revolution in the way that we look at it. Most people think we're still talking about random genetic mutations.
Mm-hmm.
That theory's been out for 10 years. Like, cancer is not caused by random genetic mutations. There are genetic mutations, but there's nothing random about it. That is, if you look at something like asbestos or something like that, it causes a certain type of cancer, mesothelioma. There's nothing random about that. It doesn't cause colon cancer, it doesn't cause prostate cancer, it doesn't cause breast cancer. Something like obesity, very important for breast cancer, colorectal cancer, has almost no impact on lung cancer.
Right.
So why is that? They're not random. So there's a rhyme and a rhythm to this, and I think that this is what the book is about. And honestly, the answers that they're finding now they're just mind blowing. Like the implications are mind blowing. So I actually, of the books that I've written, it's probably my favorite one. I actually think it's so interesting, just from an intellectual standpoint. From what you can do about it, it doesn't change things much, but just from what it is like as an intellectual
Yeah.
problem,
Yeah.
is really probably my favorite book.
Yeah, and we do want to encourage people to think differently. Like in my training with functional medicine and nutrition, I think differently about how I provide care, and it goes down to what you have said many times: root cause, root cause, root cause. I'm not looking to solve a problem as much as I'm trying to understand why it happened in the first place, and then we can make some headway. So I just wanted to make sure the listeners were aware of where you were going with that book and how it can help them. And I really, of course, appreciate you. I know we're going to run to do our work as clinicians in a moment, and I'll just say a few final words. I thank you again for being here today, Doctor. So,
Thank you so much.
absolutely. So, Dr. Jason Fung and his team have learned that intermittent fasting can help us reverse chronic medical conditions like diabetes. And Dr. Fung has shared this healing message in his books as well as through the work he's doing with the Intensive Dietary Management Program. So, guys, what we've learned is that there's another way. There's no need to live a life of chronic disease. That's not your destiny. You were not born to be a pincushion with chronic diseases like diabetes. We all have a role to play, both for ourselves, the ones we love, and if you're a clinician, the patients you serve. So, as we learn from experts like Dr. Fung, make sure to spread the message that, we do have access to the healing powers, and we'll get a lot of that through things like intermittent fasting and carb restriction. So, I really appreciate all of you guys who took a moment to listen or watch this podcast. And of course, until we meet again, be safe, be well, and continue to protect your nest.